pathways in mind clear, what will I do when I find somebody with a substance use or a mental health problem that I can't handle? Given, though, that all of us who are in primary care, if that's your main audience, are skilled to do a brief intervention for alcohol, to do a brief intervention for drugs, and to manage common day-to-day anxiety and depressive symptoms with counseling approaches or SSRIs or whatever we use. Given that you've thought through that and you know where that pathway is going to go, then what we really need, I think, right now is a very simple, concise screening approach, small number of questions that will capture alcohol, drugs, and your common mental disorders. And so my go-to right now is to ask people in the clinical setting, do you do a quick screen for anxiety and depression? And there are 2-question screens out there now. There's a GAD-2 and there's an anxiety screen with 2 questions. And we need to be asking those questions. And a good primary care provider is going to look the patient in the eye and say, you know what? This has been a really stressful time. How are you doing with the pandemic and all that's meant for you and your family? And listen to what they say and then ask those screening questions. And then we can follow that with, what about substance use? Some people, when they're stressed and dealing with situations like this, use more substances, and then use whatever your quick alcohol screen is. It might be the single alcohol screening question, or the Audit C is phenomenal. It's only 3 questions, so use one of those for alcohol, either the single question screen or the Audit C, and the single question for drugs.